Hello, how are you? Fine, thank you. Today we'll be discussing the topic of health, communication for deaf people. You're a big D-deaf person who uses NHS services. That's right. How does communication work for you? Well, in two ways. Firstly, when I go to my GP for an on-the-day appointment, I need to go in, ask for an appointment, and then I speak to the GP face to face. I need to lip read, which is quite difficult. Sometimes he writes it down for us and then we talk. Secondly, I go to a hospital. It's a planned visit and I have an interpreter. The hospital arranges the interpreter for me. It's their responsibility. That's quite easy for me. Often deaf people say that the GP skills are not very good at communicating with deaf people. Often GPs communicate poorly with deaf people, according to research. What's your experience? My own GP doesn't communicate very well. His communication skills aren't very good. He tends to just talk. It's very difficult for me to follow. My brother is a GP in another area. He studied for a very long time to become a GP, 7 years. In all that time, the deaf awareness training that he received was just half an hour. That's not enough. I feel communication is very important for all people, especially for health, especially for all patients. It's a basic. As nursing students, we learn lots of different strategies for communication. One that I like is called RASA, R-A-S-A. R stands for receive, A, appreciate, S, summarise, and the last A is ask. It gives a good structure to follow for listening for all people, and particularly for deaf people. Lots of different ways of communicating. What's important for you? For me, face-to-face is important. I can follow people's facial expressions and lip patterns. Their emotions and their facial expressions are important. Face-to-face is best. For me, I prefer to use BSL. I prefer an interpreter to be there for me. Not all deaf people can sign, of course. In the UK, there's very many people that are deaf. Six million people are either deaf or hard of hearing, but of course not all of them use sign language. Just a small percentage do. That's 1 in 6 people deaf or hard of hearing. That's a lot of people. Those statistics come from Action on Hearing Loss. It's important that we have deaf awareness and are able to communicate with deaf people. Really important, especially about health. It's really important to have access to health for everyone. I'm learning about health promotion. The topic I'm concentrating on at the moment is obesity and access to information about obesity for deaf people. Hearing people get information from TV, radio, information's all around us. For example, Change for Life. It's on the TV, it's on the radio, as well as leaflets and poster campaigns. Deaf people might miss those audio messages. Do you feel that campaigns of that nature are inclusive? No, not at all. Information gets to me in two ways. Maybe leaflets and written information, that's one way. Many deaf people don't have the same amount of English reading skills as hearing people. And written information is sometimes missed, or sometimes can't be understood by deaf people. Sometimes medical written information is complex. Yes, that's right. Another way would be TV. Often adverts don't have subtitles like programmes do, so the message in the adverts might be missed by deaf people. If it's a health promotion advert, subtitles should be there. I feel that's important for access. Why don't adverts have subtitles? Or is someone signing, just like on programmes? A GP could have a DVD with spoken, subtitles and signing to give to people who can't access written information or audio information. They could lend it, they could give it for free. Deaf people could say, "Oh, thank you, take it home and watch it." And then that information would be clear. That's a good idea. Deaf people need communication, deaf people need information. For example, sometimes a deaf person might get information wrong. They might find it difficult to access the information. Sometimes they might miss information, particularly when lip reading. English words can sometimes be complex. In the future, that might result in poor health for that person and more costs for the NHS. For example, more medical testing for that person was unnecessary. A diagnosis might be something simple, but if they miss the information, that's not fair. Sign Health give good information for deaf people. Do you feel it needs to change? Yes, it's important that it does change. I feel the NHS is a wonderful institution. Nurses, doctors, so many wonderful things, so many wonderful people. But sometimes, where's the deaf access? Where's the information? It's my right to receive information and access. It's my human right. I want full information about my health and support when I need it. Sometimes I feel anxious. And then if I'm given more information, it makes it better. A while ago I went to the doctors for some blood tests. Took the blood tests, sent them off. I came back and I had anemia, not enough iron. Okay, so they gave me some tablets. I was lip reading the doctor that day and I went to get the packet of tablets, got them, took them. That was fine, finished them. Still really tired though after I'd finished them. Well, just carried on. Went to a hospital appointment for some blood tests and I was anemic still. The consultant who I was seeing that day was worrying and saying, oh, maybe it's possible you've got cancer. I was really frightened. What's the problem? I was thinking. Oh no. I was so worried, really stressful. What about my children? Oh, what a big problem. Quickly I went to the appointment that they organised for me, speaking to the doctor about having anemia. They were asking me about the tablets. I said, I've finished those tablets. The doctor said, no, you must carry on taking them all the time. Oh, I hadn't realised that. That wasn't clear in the discussion. Oh, so now I take tablets all the time. Carry on. Every day I just take them. Now my iron levels come back up. I haven't got a problem and I'm not anemic. Because the information wasn't clear in the first place, I didn't realise that I was doing something wrong. I feel stupid, but of course I'm not stupid. I didn't have the full information, that's all. Might be a small problem like that. Might be a really big problem. You might actually have cancer. There's a big question mark over whether people are getting the right amount of information. Yeah, that's really bad. In Austria, they have a separate unit, especially for deaf people. It's attached to a bigger hospital. The reason is to give deaf people holistic care. They noticed in Austria, they realised that deaf people's health was a lot more poor, a lot worse than the general population. Worldwide is the same. Kuenberg in 2015. Said maybe in the UK they should do the same as Austria, to give services for deaf people separately from the rest of the population. What do you think? Yeah, it's a good idea in principle. It's a good idea to look after deaf people as well as you can, but as well it makes me sad. Why segregate deaf people? Why not be inclusive? Why not get interpreters booked when they should be? Why not give clear information? They should do. Why should deaf be separate? Austria recognised the problem and they've looked at access, and they're trying to look after people as best they can. Yeah, I agree, it's a shame. But simple things can help. Lots of small things, lots of different things. Write things down. Communicate face to face. Ask, have you understood? Ask about medications. Do you understand how to take your medications? When will they finish? Ask and clarify. Make sure the information's been received clearly. I feel there's a problem. People don't think that deaf people have got a problem in the community. They don't understand and they don't realise. They think, oh, deaf people, they're fine, they just can't hear. They don't realise the effect that it can have on the deaf person. I agree. I think more education is needed. For NHS staff in the future, we need to invest in that. It's so worth investing in that. Just as an example, it might be the first time a deaf person's understood how to take their medication, and then they carry on, they're well. It's cost effective, as well as better for the person. Information's clear in the first place, interventions aren't needed further down the line. I agree. Thank you for talking to me today.